Every 15 minutes, someone dies from completing suicide. That's roughly 38,000 suicides each year. To put that into perspective, that's twice as many people that die from traffic fatalities in a year. So what's happening? Well, roughly 90% of all suicides are related to mental health illnesses, and global mental health is an area of public health that's a little bit behind. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. There it is right there. Mental well-being is part of the definition of health. So why is it that we are so timid around this topic? Well, it's because mental health is frequently stigmatized around the world, and some cultures don't even have words to describe mental health illnesses. And on top of that, it's a difficult topic to discuss. This is exactly what global mental health professionals work to address. They want to break the stigmas around mental health to decrease the global burden of disease due to mental and neurological disorders and to improve overall well-being of people. But mental health and well-being go beyond neurological health. Did you know that depression is a risk factor for developing chronic diseases like hypertension, cardiovascular disease, and diabetes? Mental health is a complicated area to study. It is extremely integral for our personal well-being and health, and can be affected by so many things like the community you live in, your access to care, sexuality, whether or not you use substances like alcohol, tobacco, or other drugs, if you've moved between cities and countries, and even how and why you moved to your new home. Global mental health professionals can be researchers, scientists, physicians, field staff, and even people working in outreach. Some work with healthcare and data analysis, some work in the humanitarian setting with refugees and asylum seekers, some work in the clinical or hospital settings, and some work with organizations to change policies and to provide more resources to people. Here at NYU GPH, we work with all of the factors that impact daily life, teach you how to ask questions to assess mental health, how to conduct mental health research, how to develop themes about why one community might be more affected than another, and prepare you to work with this complex topic in many different settings.